I'm a neurologist, and I've learned during my long years now career in neurology that actually no neurological disorder has, or actually each neurological disorder has some implications with sleep or on sleep. So the best example is stroke, for example. So, and in my clinic we have about 300 beds. So about 2/3 of the beds are filled with patients with stroke. And in stroke, the prevalence of obstructive sleep disorder or other forms of sleep disordered breathing is about 60%. So, which is really high. And we know for the aspects of secondary prevention for stroke, it's really necessary to have an eye on the breathing aspects in stroke patients. So this is one of the overlap. The other overlap, for example, neuromuscular disorders. So I'm also specialized in neuromuscular disorders, and we know that in neuromuscular disorders, when the breathing system, the breathing muscles are affected, we have a high impact on sleep quality and sleep in general, which can develop then also in the needs of artificial ventilation for these patients. But when the symptoms start, you see it during the sleep phases. So these are just two examples, but actually there's no disease in neurology which has not an impact on sleep. The other aspect are, for example, insomnic symptoms or insomnia, and we just published a German guideline for insomnia in neurological diseases, and we see that in epilepsy, in migraine, in stroke, in Parkinson's disease, we also have a increased prevalence of insomnia. So for that reason, I think sleep and neurology fits, and rehabilitation, because rehabilitation and then the long-term treatment fits together.